All right, so Marcelo is kind enough to go to our 3D image wall. And Marcelo, the doctor mentioned a rotator cuff tear. Kind of explain to us a little bit more what that is and how it pertains to this image we're looking at.
Okay. So the rotator cuff is a dynamic stabilizer of the shoulder. So it helps stabilize when you're throwing. This is one of the muscles, and you can see here that this is, a tear of most likely the supraspinatus tendon. There's the infraspinatus, supraspinatus, subscapularis muscles, teres minor that are all comprised of the rotator cuff. And the tendons attach here on the humerus, and they offer stability.
And let's say, looking at that, would you say on a scale of 1 to 10, 10 being the worst, what is that one?
This looks like a complete full thickness tear of the rotator cuff. Could have been a traumatic fall. It also could have been just a chronic repetitive type use injury. In this case, I would assume I would need to talk to the patient and really get a thorough history to determine the true cause of the tear.
And what other injuries might you see to the rotator cuff, for example, if you overuse because you're throwing too much?
That's a good question. Typically, the injuries to the rotator cuff will begin as an inflammation of the tendon, which is typically called tendinitis. As that progresses, it's less of an inflammation and more of a micro tearing of the tendon, which is called tendinosis. And as that progresses, it leads into partial and full thickness tears, which I believe is probably a full thickness.